Hello, my name is Lisa Maragakis from the Johns Hopkins University School of Medicine, Associate Hospital Epidemiologist at the Johns Hopkins Hospital, and a new site advisor for the Medscape Infectious Diseases website. I'd like to speak with you briefly today about hand hygiene. While not a terribly glamorous topic, hand hygiene is an extremely important issue in infection control and patient safety. And as such, we owe it to our patients to take hand hygiene extremely seriously and to find ways of accurately measuring the compliance with hand hygiene recommendations among healthcare personnel, and more importantly, ways to improve that compliance. Despite the importance of hand hygiene, studies have consistently found that compliance among healthcare personnel with hand hygiene recommendations is extremely poor, generally less than 50%. And this is clearly unacceptable and an area for great improvement in patient safety and the prevention of healthcare-associated infections. So why do healthcare workers not wash their hands? That's the million-dollar question. Studies have pointed to a variety of factors, including the level of professional education, the availability of hand hygiene supplies such as alcohol hand rubs, or the proximity of sinks to patient care areas, the level of patient acuity, the ratio of healthcare personnel to patients, and other issues such as the availability of role models who can model the correct hand hygiene behavior for others in the healthcare setting. When healthcare workers are asked about hand hygiene, most will heartily endorse hand hygiene's importance and call it an essential part of patient care. However, most healthcare personnel vastly overestimate their own compliance with hand hygiene recommendations, and this is when compared to an independent observer who measures hand hygiene compliance. This brings us to an important issue. How does one accurately measure hand hygiene compliance in the healthcare setting? The Joint Commission requires such monitoring of hand hygiene compliance, and many states are moving to public reporting of hand hygiene compliance among healthcare personnel. Several methods have been proposed, including the measurement of soap and/or alcohol hand rubs in the healthcare setting. These data can be difficult to find, and it is not clear how well they actually measure the hand hygiene compliance in the setting. Another method is direct observation, which has been considered the gold standard of monitoring hand hygiene compliance. However, this method is fraught with difficulties, including the fact that it is extremely labor-intensive. It also involves recruiting and training observers who are not known to the clinical unit so that the measurement can occur without influencing behavior. It is also quite difficult sometimes to overcome the technical issues involved with monitoring compliance when some settings, such as the patient care room, may have sinks inside, and if the door is closed, technical issues arise with monitoring compliance. Despite this, we have embarked upon a direct observation program at our university hospital, developing a standard data collection tool and training observers to perform hand hygiene monitoring. Other methods include the use of electronic devices that are connected to the doorways to monitor entry and exit of the room, as well as to sinks and hand hygiene dispensers to monitor hand hygiene compliance. In addition to issues surrounding measurement of hand hygiene compliance, clearly interventions are needed to improve hand hygiene compliance. Interventions that have been studied include education campaigns, as well as hand hygiene promotion tactics such as posters and other high visibility reminders to healthcare personnel to wash their hands. Certainly adding additional sinks and dispensers of alcohol hand rub has also been implemented to try to improve hand hygiene compliance with variable results. Overall, Hand hygiene is a serious concern in the healthcare setting and one that desperately needs to be addressed, probably by a combination of these interventions. The electronic monitoring that I mentioned earlier can also be used with audible alerts and reminders to alert healthcare workers that they need to wash their hands. And finally, patients have also been brought into the process and encouraged to remind healthcare workers to wash their hands. However, studies have found that few patients feel confident enough to confront their healthcare worker to remind them to perform hand hygiene. So in summary, this is an incredibly important aspect of patient safety and infection control. And as yet, we have not solved the problem of how to accurately measure hand hygiene compliance, and more importantly, how to improve compliance with hand hygiene recommendations in the healthcare setting. I welcome your comments and postings about your own experience and your own solutions to this problem in your healthcare setting, and I hope that you will post on the discussion site. This is Lisa Maragakis signing off for Medscape.